This is Long Beach Community Television.
Imagine natural vision improvement. Is it possible, using what we have around us at this time, using nature and some of the other elements and so forth, can we actually improve our vision, or are we destined to have it get worse and worse as we get older? And how does this incorporate with our whole body, and what other things can we do as modalities to help improve our ability to see? Well, today's guest, Deborah, I'd like to welcome you to the show.
Hi, how are you?
Great. She's an ophthalmologist who also is basically trained in surgery also, is that correct?
Right.
And she spent almost 15 years, I talked earlier, or more, studying, trying to find out alternatives to vision. Perhaps you could tell us a little bit about yourself, some history of how you got involved, because I know it's kind of traumatic with your own vision.
Right. Well, first of all, I'm Dr. Deborah Banker, and not only am I an ophthalmologist, but I'm also a general practitioner, and I work with Western medicine, Oriental medicine, holistic medicine, herbal medicine, and a new field that we call electromagnetic medicine.
Mm-hmm.
And I try to take the best, most valid answers that we can see and combine them together. I had problems with my own eyes, and I'm sure this is what made me much more sympathetic to alternatives. In my own particular case, when I had to read a great deal when I was in college and medical school, my eyes simply were not strong enough. They would dry out, they became painful, they became light sensitive. I got to the point where I could only read about a half an hour at a time. Mm-hmm. And I had to hire people to read for me into tape recorders. That meant I couldn't read as fast as everybody else could. I would be listening to these tape recorders late at night in the dark, and I was almost had a panic because I wanted to become a doctor, and I had huge loads of studying and really didn't know what the problem was, and there wasn't anybody who could tell me why this was happening. Mm-hmm. Also at the same time, because of the long hours that I was reading despite all the pain, I became nearsighted overnight, just like that. And that was spasm inside the eye called the ciliary body. There's a circular muscle inside the eye, which we're going to be talking about a little bit more, which just went into spasm. And what happened there is the doctor put me into contacts, and the contacts were helpful. Okay. But when I would take them out, what vision I had before became less and less and less without the contacts. So my eyes were becoming weaker. And I probably would be in them today, except for the fact that during a Christmas vacation when I was in medical school, I got an infection in my eye, couldn't wear them for 2 weeks, and my distance vision came back because I didn't have to use them.
So you're forced not to be able to use those contacts.
Right. Huh. Now normally people don't have that type of break because normally, but it just happened to be Christmas vacation, so I did not have to read at that time. And so then I went to the doctor, and he said, well, great, your distance vision is perfect. I said, well, that's fine, but why can't I read long hours for near? And he had a woman in her clinic who is called an orthoptist. And this is a vision trainer, and what they work on is with people who have problems with the eyes crossing or not coming together. And my eyes, though when you look at them right now, they look fine.
Correct.
When we look for near and we look at and we read something, your eyes actually come together some, okay? And so when you're looking at something right here, whether you realize it or not, your eyes have slightly turned, okay? Oh, wow. Well, my eyes didn't want to. All right, and so she taught me exercises. I did them, probably 20, 30 times a day, and within 2 weeks, I increased what's called your binocular vision, or to be able to see stereoptically, by 200%. So this was just the beginning of some of my understandings, and then I started taking Oriental medicine, and I was taking classes in Oriental medicine and studying alternative medicine at the same time that I was studying my residency in regular Western medicine.
Boy, you're a strange bird then.
No, no. I could see the correlation, and I could honor the information from both these different fields and their different perspective. But what I realized, my eyes were drying out. At the same time, my stomach got nervous. Okay, and I was getting stomach pains, and now I realize that there is an electrical meridian. It's Oriental medicine meridian that goes straight from the stomach and into the eyes. Well, when you become nervous, you're in the stomach, it will cause hyperacidity, and when that same energy then travels up that meridian and goes into the eyes, it dries them out.
Does the acidity cause the pH itself cause the drying out? Or
No.
It's just
it's more like your nervousness or your worry causes a change in the biochemistry. Now, in the stomach, what the stomach is going to do is have too much high acidity. But what the eyes are going to do with that same electrical phenomena, okay, it will do the dry. Now, see, I see the body slightly differently than most people. I see it that we have an emotional level. Okay, that emotional level can change the electrical level, okay, and we do have an electrical field. That electrical level, when changes our autonomic nervous system. When you change the autonomic nervous system, you are changing the levels of the secretion of the entire body, and if that's not taken care of and brought back into balance with acupuncture, massage, various things, then it will then affect the physical, and then you're going to start getting things like ulcers and heart attack, etc. Okay, and so again, the level of the emotional and the electrical is not very well understood in Western medicine. We see it mainly as a biochemical physical. It's not that there isn't a biochemical physical, yes, but you can enter the body at any of these levels, change the physical, change the biochemical, change the electrical, change the emotional, and they all will affect the other.
Oh, so it's up and down the plane. So there's many different answers to this idea of health, and that we have people that seem to be in certain fields, whether it's in the physics level with electricity, or whether it's down in the level in regards to the biochemistry.
Or someone who is working, for example, calming the stomach with, let's say someone does have stomach problems, and so you may have a Western doctor who puts them on antacids or Tegamet. And that's one level. You could also get them off of acidic things and coffee and fried foods. That would be another level. Or you might have an herbalist who maybe would put them on slippery elm, which would be, and peppermint and chamomile, which would be good for the stomach, which would be another level. Or you might have someone who would do acupuncture, who would relieve
the energy blocks?
The energy blocks in the body. Or then you might have someone who works on more of a psychological level and trains them how not to get so worried about things. And each of these levels are valid.
Right, because one's going to affect the other. We know that emotions affect the nervous system. I mean, anybody can see that you have reactions according to the way you perceive events around you. Now, you have a picture here. I guess it's more of a diagram of an eye and goes into some areas that you mentioned earlier. Perhaps you want to list a little bit for the audience.
What we're trying, the work that I probably am best known for is how to improve the eyesight naturally. I am an ophthalmologist, and that makes me an eye specialist. And I've written a kit with books, tapes, and videos to teach people about the various problems in the eyes and how we can reverse them naturally. And so what we're talking about right here, why don't you tip it back just a little bit right here, okay? Sure. And what we want to, right now, what we're trying to show people right here is some of the anatomy. Here we have the cornea, here we have the iris, behind that is the lens. It's attached to the ciliary body, which is another circular muscle right here, which constricts and expands for distance and near. Behind here is a gel. Hold it back just a teeny bit, right there. No, just the there you go, the top. And then back here we have the optic nerve and the macula. Now, one of the first things that I want people to realize is when you get into reading glasses, okay, at the age of 40 and you lose your ability to see for near, it's actually because of a physical problem. This muscle right here, it's a ciliary body, it's a circular muscle, and that particular muscle, it starts becoming fatigued. Now, it becomes fatigued for a couple of different reasons. One, it's because we've spent a lifetime of reading out here, okay?
Right. So
and we very rarely challenge the distance in between or even look, and so that is a muscle that if you don't take it all the way, is total way, it will become fatigued, just like any other muscle. And to keep your slim body at any age, you have to take whatever the muscle is through its full range, or it will begin to lose its ability. Now, the doctors will say, well, the reason that this fatigues, it actually is stiffening up. Well, there's some truth to that, but part of that stiffening up is worse when you drink coffee, worse when you eat junk food, and that I can see for myself when I've been up late at night, haven't gotten a lot of rest, been not eating poorly. I mean, I have, not eaten well,
Right.
and I've had a lot of coffee, that mechanism is harder to get going, shall we say. But you can do exercises to bring it back, and this is what the orthoptist taught me. And if you succumb to just reading glasses, what will happen is what ability to see for near you will lose very quickly. And within a month or so, you will, what you had before, even though it was difficult to see with, you've now lost. And I feel that not only with the reading glasses, cause you to lose your ability to read for near. Not that you weren't having a problem, but what you needed in the beginning were exercises. And there may be even a point where the exercises won't do any good and you may need to have glasses, but certainly not as early as we do, okay?
So does the glasses itself kind of in a way suppress that muscular action?
Absolutely, and I think it accelerates the atrophy of it. And the doctors will again say, well, the lens has stiffened up. Well, even if the lens is stiffened up and no longer changes shape, because when it's young, it's like silly putty, and when the muscle is expanded, then it will be the thinnest, and when it's contracted, it will round upon itself and make the rays of light come together. But not only does it change its shape, but when the muscle contracts and you look down, it gives and lets the lens fall forward, and so it changes position. And when you have, so it falls forward from the back of the retina, so it becomes a farther distance. Well, it's like a plus lens. It's like a magnifying lens. And if you put a plus lens on the paper, for example, a newspaper, and pull it away just a little bit, it will enlarge the letters. Well, that's what this same lens, even if it can't change shape, if you get that muscle working so it contracts when you look for near, and simply all it does is it gives on the pull and let that lens fall a little farther away from the retina, it will cause a magnification. So exactly which one is going on, I'm not sure. What I have seen, I just came back from Tampa, Florida, where I was giving a 2-day class in natural vision improvement, and I had people from all ages, people in their 20s and people in their 70s, and all of their vision got better, and many of them had correction in the upper part and the bifocal, and certainly by the time the class was done, many of them did not need the bifocal and were simply using the upper part, or not even using those at all. Now, whether they keep that up after I leave and start doing the exercises, that that's up to themselves.
See, that's another point I want to bring up is, what you're talking about is maybe a means, you could say, cure or effective treatment. But if it's not kept up, just like with exercising the body, for example, then there's no guarantee that these people will maintain a good vision. Is that correct?
Right. Well, people always say, well, is there a point where I never have to do the exercises again? And I go, well, if you sat in a chair for the rest of your life and didn't move from that, well, you would lose your natural youthful tonicity. To guarantee people that they would never lose something is to guarantee their youth, That one I haven't figured out yet. But I certainly know that every other muscle in the body can be exercised, so can the muscles inside the eye. But my feeling is when you submit yourself particularly to reading glasses, even if you call them the $12, $15 dime store glasses, they are real glasses, and they will decrease the ability for the muscles to work. But not only are you accelerating your loss of ability to see for near, I feel that you are probably accelerating cataracts, glaucoma, floaters, vitreous detachments, retinal detachments, and possibly even macular degeneration. Because every time this muscle contracts and expands, it makes the fluid for the inside of the eye, which is called the aqueous humor. That aqueous humor then cleanses and bathes that lens. It's the only way the lens gets any nutrition. The lens has no blood supply. So then you get these glasses which paralyze the mechanism. Now there's still some blood and some fluid that's being made, but I'm sure it's not the same quality and quantity as was before when that muscle was pumping in a good supply.
Right, and allow the lens to be cleansed often.
Right.
Now the question I have is, a lot of terms we hear more often today are people have macular degeneration. Maybe you could explain a little bit what that really is, because we hear the term, but many people say, well, what does that mean?
Well, let's put this up again. The macula is actually right straight back here, when the rays of light, when you see something, you're not actually looking with your optic nerve, you're looking with your macula right here. Let's look at the next page right here.
Okay.
And I have another drawing, and it goes into what the back of the eye looks like, and we'll flip this around and
Right here?
yeah, right there.
Okay.
And what you see, here's the optic nerve, and here's the rays of light right here, and this area right here is the macula. And the macula is it's a very sensitive area in the back of the eye. It has a high concentration of particularly cones, and the cones are the light-sensitive area. Probably has about a million of them, and it's only about 1.5 millimeters in diameter, so it's very small, okay? So it's like when I'm looking at you, I'm looking at you with my clearest vision. But when I'm looking what's out here, I'm not seeing with my macula, only you I'm seeing with my macula. If I lost my macular vision, if people were to take their fists and put it right in front of them, that's what losing your macula would be like. You'd still have all this other vision around you.
You couldn't see right in front of you.
But you couldn't see right in front of you. Now, if you looked again at that chart again, the vessels come off the optic nerve, and but they never quite get to the macula. And also even the circulation underneath on the layers, they all split apart and come away from the macula. Now, the reason that happens is that if they did not, you would see the blood vessels, and it would be like looking through a grid, okay? And so nature has done this so that you can see well, but we as a culture eat too much meat, we clog our arteries, we eat food that's been overly processed, which does not have the natural nutrition, we don't exercise enough, and so then when we get into our 60s and our 70s, that we have compromised our circulation, and this particular area has one of the highest circulatory and nutritional demands of any tissue in the entire body.
Well, it takes in all the perceptions we have, isn't that correct? I mean, basically,
well,
it's a very important part of the...
90% of your perception of the world comes from this particular area. Now, I found something out just recently that I found was very interesting. You know, a lot of people say, well, you should be a vegetarian or certainly reduce the meat in your diet, okay? And and because it caused plaquing. Well, but why does it cause plaquing? Okay.
Good question.
So I went to this one health food show, and they were saying part of the reason that it causes plaquing is that animal meat, particularly beef, it solidifies. It needs to be 104 degrees to melt. Let's put it that way.
Okay.
Okay. So what's our body temperature?
98, so it's not liquefied.
98.6, so it doesn't liquefy in our body, okay?
Right.
And even if people take their meat and they cut all the fat off, there's still fat in the meat cells themselves.
Sure, in the muscle, there's still fat. In the muscle of
the, you know. And so if people are on a very regular diet and they have meat on a continuous level, even if it's just a little serving every day, that's going to start to plaque up the arteries. Now, there have been a lot of studies that there are many ways to help to remove this plaque. Chelation, okay, but there's also oral chelation besides having venous chelation.
Okay, sure.
Vitamin E helps to keep the plaquing down. Cayenne pepper, lecithin, garlic, ginger, niacin, these all help. Hawthorn berry helps the circulation. So these are various things. And also people who've become vegan, which means they have no animal products for 6 months, many times can clear a lot of the gunk that's in the
deposited.
The deposit.
Also, I heard not just only the meats, but I heard isn't it just frying anything causes a lot of that damage?
If you take and you, particularly when you do this crispy fry, this you know, Kentucky whatever.
French fries, whatever, Kentucky Fried Chicken.
That you take the oil that was liquid before and you fry it up, and now it's become saturated. Okay, and the same thing happens when you take oils like corn oil and saturate it, and it becomes margarine. Now the whole purpose of thinking that you're doing yourself a good job because you're not using an animal product, you're really better off using the animal product and using some butter than you are margarine, because margarine also gums up the whole intestines, and
it's been shown to be. I know they had the Price Pottinger. They talked about how it's hydrolyzed and it's oxidized, and so it's also going to be worse. I guess some other eye areas I wanted to ask about specifically, because these are common with people, is what you mentioned earlier, glaucoma.
Okay.
Okay, what basically are we talking about as far as
well,
cause?
yeah, let's go back to
The original
page
picture.
right before it.
Okay, let's use this for a reference.
All right. Now, one of the reasons that I've seen here, this is again the ciliary body, and right above it is a drainage system which is called Schlemm's canal, right where the cornea and the iris come together. Now, the fluid's made by the ciliary body, comes forward, goes out the pupil, and then has to drain at this side. Well, we've seen with electron microscopy that there's a meshwork pattern that the fluid has to go through. It's not a straight channel, okay?
It's like a filter in some
Yeah,
way?
kind of like
Okay.
a filter, and they're called trabeculae. Well, they get thickened up as we get older. They get swollen, okay? Now, every time the ciliary body contracts, there's a connection between the ciliary body and Schlemm's canal, which is called the longitudinal muscle. But it's never, once you read it in anatomy, it's never mentioned again, okay? Well, why? Every time this thing contracts, I think that it pulls on that mechanism. Because when I get people doing the exercises, which I'm going to show later, that will help to keep the ciliary body functioning and help you to see for near, it also helps to drop the pressure inside the eye. Now, I'm going to tell you kind of an anecdotal story, okay?
Sure.
I had a gentleman who came to me who was a jeweler, all right? And you know, the jeweler will take a loop and they'll put it over the one eye. In his particular case, it was over the right eye. So anybody would come in and they wanted the diamond to be looked at for clarity and stuff. He'd always put it down, and so in one eye, the one that had the loop that was coming down all the time, he was losing his ability to see for near, but the pressure in his eye, which normally should be between 8 and 18 millimeters of mercury, went up to 28. Well, he went to his eye doctor, and his eye doctor was very upset and wanted to do some laser surgery to drop the pressure. And the man called me up in desperation, and I said, look, there's nothing that I can do over the phone immediately that I'm going to be able to drop this pressure from this type of distance. He says, well, can you do something for me if I come out? I said, well, probably. And so he did, and we worked with what I call electromagnetic fields. I've done study in this for many years, and you put various frequencies into the eyes, which takes swelling out of it. The pressure dropped from, in a week's time, from 28 to 18, and we also did eye exercises at the same time, and he also read my book, and then he changed to a vegetarian and dropped it down to 16.
Wow, so you recovered?
Yeah. Now, not everybody's going to have that scenario,
Right.
okay? Certain emotions will increase. We've seen the pressure in the eye increase as much as, again, 10 millimeters of mercury just because someone was upset about a memory.
Right.
All right? We've seen the pressure inside the eye get better because they cleaned up the food that they were eating and they detoxified. All right? There are some new drops out that we've seen that help. Now, I don't take people necessarily off their Western drops suddenly, and I'm not cavalier about it, because if their pressure is elevated and they were losing vision before, just because they're now sitting in my chair doesn't mean suddenly everything's going to change.
Right.
What I will do
sense.
is I will start people on an exercise program, I will change their diet, and if the pressure starts dropping, then we'll consider to gradually taper things off. And some people you never can, because you can't change everything that every person does their life. Okay?
Right. Their lifestyle, their beliefs.
Their beliefs, what's upsetting them, all the rest of these. And so it may be a combination of nutrition, and it may be a combination of the Western medications. But even sometimes in the case of glaucoma, they can be on all the medications that are out there, have all the surgeries done, and they're still dropping pressure. I mean, losing sight, because the pressure hasn't, the pressure could be dropped even enough, and it may be that the circulation to the optic nerve isn't good enough, and that's called a low tension glaucoma. So, I mean, it's a complicated thing, and to say that there's one thing that will fix all of this is not necessarily true.
Right.
Okay? We've certainly seen exercises that will help. We've seen electromagnetic fields that will help. We've seen there's a new set of drops called MSM drops, which take swelling out. We've seen that help. We've seen there's a product out there by Manatech, which is called Ambritose,
Right.
which we've seen that help. And
So it depends upon the individual what you're using, any of those.
Yeah.
What about cataracts?
Cataracts.
I mean, that's a common one. We always hear about cataracts.
Right. Well, if they're early cataracts, there are various things that will help them. Again, I don't say that I cure them, but I've been able to help people. I've been able to slow the progress down, and we have seen vision get better. if the vision is worse than 2200, and 2200 usually means that they can't see better than the big E on the Snellen eye chart, okay?
Okay.
Then it gets much more difficult. But we've still seen improvement with those. And there's a number of things that we have seen that have helped. Working with the exercises that are in the book that will help you to get vision, get rid of the strength of your bifocals will help. There have been studies at McGill University which showed that people who took vitamin A and E and C had a much less likelihood of getting it. Pycnogenol, which is a new antioxidant, has been seen to be helpful. There is a herbal preparation that actually was approved of by the FDA, and of people who are out there, get your pencils right now, I'm going to tell you how to spell it. It used to be in the ophthalmic or the physician's desk for eye doctors, but it no longer is, and I don't know why. But anyhow, it's called Succus cinerea maritima.
Okay.
And that's S-U-C-C-U-S, Succus, second word cinerea, C-I-N-E-R-I-A, and third word maritima, M-A-R-I-T-I-M-A, Succus cinerea maritima. And here in LA, I know that you could probably get, and this is something that if you do, you need to convince your eye doctor to follow you along with, but you can get it at the Santa Monica Drug in Santa Monica. They'll help you order it.
Oh, that's great.
But the stronger concentrations, you need to have your eye doctor follow along, because in very rare conditions, it may elevate the pressure inside the eye of someone who has the predisposition to glaucoma. So this is why they haven't just put it as over-the-counter. In some of the lower dosages, it is an over-the-counter, but in the very high dosages, which I think are probably the better product, they help to stimulate the circulation in the front part of the eye. And if your doctor is willing to follow you along, I have seen, now it may take 3 to 6 months before you're going to even see a change in this. But we have seen that in 40% of the cases, it will reverse early cataracts, and in 80% of the cases, it will slow it down. So it's
great.
really very, very significant, and most doctors haven't even been trained that it's there.
What causes cataracts? I mean,
It's a circulatory problem.
Circulatory?
You know, again, this whole process of focusing for near and the ciliary body pumping back and forth, the circulation, the amount of circulation comes to the ciliary body makes the quality and the quantity of fluid. Because there are other things out there. There's a product out there, drops by a Dr. Christopher. He was a naturopathic doctor, which have things like eyebright and
I've heard about that. Yeah.
you know, bayberry leaves. But one of the main products in it is cayenne pepper. Now, I really wouldn't advise you make your own, but their particular product, and if you can't find it, we'll help you to find it, may be helpful. And there may be a point where all the things I tell you don't work, and you're still going to have the surgery. But we've seen many people make progress on this. Another thing that we do, we'll do hot soaks with Epsom salts. Epsom salts in a towelette, and put that over the eyes, and then a hot pack over that. Now, Epsom salt is magnesium sulfate, and it's one of the strongest vasodilators out there.
I hate to interrupt you, but we've just finished this program right now because we've come to the end, and I want to thank you for being a guest.
Okay, thank you
Deborah,
so much.
it's great. This has been Imagine, Natural Vision Improvement. As you can see, there are many possibilities. Take the time to do your research and find out from Deborah and other individuals what you can do to improve your vision and hopefully improve your life. Thank you.
And if people will look at the end of the screen, they'll see we're going to be having some classes coming up the next couple of this next month, and the telephone number of how they can get in touch with us.
At the end. Very good. Thanks. I made sure we got that. So, you know.